All right, welcome. This is the first edition of the MBiz Minute. My name is Chuck Davidson. I'm the president and CEO of the Manitoba Chambers of Commerce. And what we're doing now is having discussions in this COVID-19 reality that we're now living in, and having discussions with companies in terms of some of the measures that they've taken and how they're adapting in this new world. So on today's edition, our inaugural edition, we're joined by Robert Cuthbertson-Black, who is the Director of Business Development with PCL. Robert, welcome to our first edition of the MBiz Minute.
Thank you, Chuck. I appreciate the opportunity.
So I guess first off, tell us a little bit about PCL and what you guys do as a company.
Well, I think most people are familiar with us as a building builder, but really we look at a little bit more than that. We're trying to leave a positive difference on our communities by working, living, and playing, and really investing, in the communities that we're part of. We have a variety of lines of work that we do. We construction manage, we build, we develop solutions for people. So it's a pretty broad spectrum of things as Canada's largest builder and one of the largest in the world. I'm relatively lucky on a local perspective because construction has been maintained as an essential service.
Sean Barnes, the Vice President of Special Projects with PCL. Sean, we're just talking a little bit about some of the new developments that PCL has undertaken as a result of COVID-19. And specifically, we were just having a bit of a discussion, Robert, in terms of the new product that you've developed that will help with testing. I wonder if you can maybe explain a little bit and maybe share with us what it is and how it works.
Sure. At the onset of the pandemic, I was asked by our Office of the CEO to get in front of all of the business opportunities and change that was coming about as a result of the pandemic. And so I got involved in a bunch of field hospital work in the United States and in Canada early on, and then that's transitioned into a whole bunch of different things. And the Portable Virus Testing Center module came out of this, as was the quarantine can, which originated right here in Winnipeg. So the Portable Virus Testing Center is a module that is in multiple configurations, 20-foot, 40-foot drive-through, walk-up, individual pods. And like the quarantine can, it is an isolation module. So if you think of an ICU room in a hospital that has negative air pressure, and it protects not only the patient, but the doctors and nurses that are working within it. So these modules that we're building are built to that standard. And then they incorporate an enormous amount of technology, if a customer wants it, to be able to screen and test employees. And so we initially built this thinking that our primary market was going to be healthcare, right? So in Canada, your regional health authorities in different provinces, the federal government, and then hospitals in the United States. And what we've quickly learned is that there is an even bigger need for this as a tool to be used to enable businesses to return to work, right? So we have the ability to connect customers with an operator, so a company that will put nurses in the facility and provide test kits and do testing. And then there's AI, thermal imaging cameras, different programs that allow for frequent testing as a company or an organization may need to keep their people safe, or as safe as possible in a return to work environment, because there's going to be an ongoing need for testing. It's going to have to be ramped up. People are going to have to be tested frequently, especially in essential services. And so we now have a high-tech product. We've built 4 prototypes. We've only really been out in the marketplace for a week, and I'm just watching my stream of emails here of companies and industries that are saying, this is a really good solution for us to consider to get back to work.
Because I think that's going to be key for a lot of businesses, and exactly to your point, is wanting to make sure that their employees are safe and on the job. Because a key component of that is, the testing, if they're going to have them coming into their location, and what the process is going to look like. So I think that's a very unique idea that you guys have come up with, and I can absolutely see how businesses would want to use this in the future. I'm curious, Sean, as well, just, what sort of a vision do you see for PCL sort of as this post-pandemic as we try to get back to this new normal? Is this going to have a significant impact on construction, on the industry? And I know a lot have talked about the need for increased investment in this time of when you're kind of trying to re-kick and then restart an economy is typically a good approach to be taking as well.
That's a real good question, Chuck, and it's got a whole bunch of layers to it, right? So most companies have looked at things right in the onset as to how it's going to affect them specifically, right? And so I read a really good report that's helped frame some of our thinking in the initial weeks of the pandemic. That came out of the McKinsey & Company, the consulting firm, and they framed the pandemic into a few horizons. One was kind of the immediate resolve horizons, where companies are trying to figure out how to just, retrench. What do we need to do to be able to survive in the near term, which is what we're in right now. Then there's the return to work horizon, which is how do we return to work and keep people safe. And then, the reimagination horizon, like what's going to change forever in our industry and other industries. Because honestly, we take a look at this and say, our business is going to change forever. Our customer makeup is going to change. The way that we conduct our business is going to change. The way that people operate in office environments, including ours, and we just built this wonderful new building, is going to change. And so we've done a bunch of research on a number of different things related to the construction industry and PCL in particular. And some of it is, where are there opportunities? Where do we need to pivot our business to be able to help our customers also return to work? That's actually a focus right now, is we're talking to as many customers as we can to understand what problems they're trying to solve, because we're talking to so many people throughout North America. We're getting to hear about different things that people are trying to solve, and then we're sharing things that we're hearing as potential solutions. And if we're acting as a conduit and sharing that sort of information. We're partnering with different companies that we have a great deal of experience with in trying to solve some of those problems. So for example, the entire healthcare system has been stressed through this crisis. And what every hospital and every clinic in North America and around the world has seen is where their vulnerabilities are as a result of this pandemic. And what it's done is it's kind of shone a light on different things that different facilities may need to address in the short term to be able to deal with future waves of the pandemic. It will also have an impact on things that they need to look that are a little further downstream that may require a greater investment to deal with future waves of the pandemic. And I also think that hospital design from this point forward is going to change. So anything new that's built will incorporate change in design so that we can be better prepared for these sorts of things. And that will have a direct impact on our industry. And so, things, I can give you a couple of examples. So medical gas supply in any hospital has been absolutely tapped out as a result of this. So when you design medical gas, and Robert's a mechanical engineer, he can correct me here where I'm wrong. So you design a system based on 100% capacity, meaning every place where there's a connection to oxygen is at full capacity, and then there's a usage factor that's applied to that reduces it, right? So because you're never ever considering that every single connection point is going to be used at its maximum capacity, so the system is designed to be less than that. And so what we're finding with COVID is no, they need everything that's available and more. And so we found that medical gas supply systems are undersized. There's things like having to screen and divert people that are coming into the hospital. So the Health Sciences Center, for example, might have 50 different entry points on its campus. Through this crisis, they've reduced it to 5.
Right.
And at those points, they're screening and triaging people and diverting people away from the hospital. So now what's going to happen is every emergency department and every hospital is going to change the way that patients are taken into a hospital.
I want to thank Sean and Robert for both taking part in our sort of initial conversation with PCL, just in regards to what the company has been doing. Obviously, some exciting things as well in relation to COVID, and a little bit of a discussion in terms of the future. So again, thank you, gentlemen, from PCL in terms of the work that you're doing, and we appreciate it on behalf of the Manitoba Chamber of Commerce, and thank you for being part of our initial call.